Can penis size be increased after the age of 55? It's a question many men wonder about, but may feel uncomfortable asking. As men age, their bodies change in many ways, and for men over 55, these changes can affect how they feel about themselves and their intimate relationships. Many men notice their penis appears smaller as they get older, which can cause concern or affect confidence. This happens due to several natural factors including reduced blood flow, decreased elasticity of tissue, and hormonal changes that occur with aging. However, understanding these changes and learning what can be done about them can help men maintain both function and satisfaction throughout their later years. When discussing penis size after 55, it's important to separate fact from fiction. While significant natural growth is unlikely past puberty, there are legitimate approaches that can help maximize what nature has provided. Much of what determines how large the penis appears during arousal relates to blood flow. Better circulation leads to fuller, firmer erections that showcase your natural size potential. Many men don't realize that factors like cardiovascular health, weight, and even certain dietary choices can influence how their penis functions and appears. For men wondering about this topic, know that while dramatic changes aren't possible, improvements in firmness, responsiveness, and even some modest increases in size can be achieved through healthy lifestyle changes and specific techniques. These approaches focus on improving blood flow, maintaining tissue health, and supporting optimal hormone levels. Unlike what many internet advertisements suggest, this isn't about miracle pills or dangerous procedures, but rather about understanding how your body works and giving it what it needs to function at its best. The good news is that many factors affecting penis appearance and function are within your control. Simple changes to exercise habits, diet, and lifestyle can make noticeable differences. Some men even find that as they implement these changes, they experience better overall sexual function than they had in years. This happens because the same factors that affect penis size also impact other aspects of sexual health, including stamina, sensitivity, and satisfaction. For those concerned about size, remember that health and function are what ultimately matter most. While society often places undue emphasis on size, partners consistently report that technique, attentiveness, and emotional connection matter far more than physical dimensions. That said, feeling confident about your body is important, and addressing this concern in a healthy, informed way can improve both physical function and psychological well-being as you age. Let's now look at the main factors that affect penis size and function after 55. The first and most important factor is blood flow. Think of your penis like a balloon. It needs proper inflation to reach its full size. As men age, blood vessels can narrow due to plaque buildup, making it harder for blood to flow freely. This is why working on heart health directly helps with erection quality and size. Regular exercise, especially activities that get your heart pumping, can make a big difference. Even walking for 30 minutes daily improves blood flow throughout the body, including to the penis. Some studies show that men who exercise regularly have better erectile function than those who don't. Have you noticed that on days when you feel more physically active, other parts of your body seem to work better too? Diet plays a huge role in improving circulation as well. Foods rich in nitric oxide help widen blood vessels. These include leafy greens like spinach, beets, watermelon, citrus fruits, and dark chocolate. Eating these foods regularly can help blood flow more easily to all parts of your body. Cutting back on processed foods, excess salt, and saturated fats is just as important since these can clog arteries over time. Staying hydrated also helps with blood volume and circulation. Many men don't drink enough water, which can make blood thicker and slower to flow. Aim for at least 8 glasses of water daily. Reducing or stopping smoking is one of the best things any man can do for penis health. Smoking damages blood vessels and reduces blood flow everywhere in the body, including the penis. Some men use vacuum pumps to temporarily increase size by drawing blood into the penis. While these devices can help with temporary fullness, they should be used carefully following instructions to avoid injury. There's some evidence that regular use might lead to small tissue stretches over time, though results vary greatly from person to person. Manual stretching exercises such as jelqing involve gently pulling and stretching the penis to encourage tissue expansion. These must be done with great care to avoid injury. Always start slowly with any new technique and stop if you feel pain. Using proper lubricant helps prevent skin irritation during stretching exercises. Remember that blood pressure medications, while often necessary for health, can sometimes affect erectile function. If you notice changes after starting new medicine, talk with your doctor about possible alternatives rather than stopping medication on your own. Hormone balance plays a key role in penis health and function, especially testosterone. After age 55, testosterone levels naturally drop in most men. This decline can affect sex drive, energy levels, muscle mass, and erectile function. Low testosterone might make the penis seem smaller or less responsive than before. Several natural ways exist to support healthy testosterone levels. Strength training is one of the most effective methods. Lifting weights or doing resistance exercises 2 to 3 times weekly helps maintain muscle mass and stimulate hormone production. Focus on compound movements like squats, deadlifts, and push-ups that work multiple muscle groups at once. Sleep quality affects testosterone production more than many realize. During deep sleep, the body produces most of its testosterone. Men who regularly get less than 7 hours of sleep tend to have lower hormone levels. Creating a regular sleep schedule and making your bedroom dark, quiet, and cool can improve sleep quality and hormone production. Diet affects hormones as well. Eating enough healthy fats is important since testosterone is made from cholesterol. Good sources include olive oil, avocados, nuts, and eggs. Zinc is another building block for testosterone found in oysters, beef, crab, pumpkin seeds, and cashews. Some men notice improvements by adding these foods to their meals. For men with very low testosterone levels, medical options exist. Testosterone replacement therapy can be prescribed after proper testing. This isn't right for everyone and comes with potential side effects, so thorough discussion with a doctor is needed before starting any hormone treatment. Hit the subscribe button if you appreciate health advice. It helps us create more content you can use. Weight management directly affects both hormone levels and perceived penis size. Extra weight in the lower belly can hide part of the penis shaft, making it appear shorter. Losing weight, especially around the middle, can make the penis look larger simply by revealing more of its base. For every 35 pounds of weight lost, men can appear to gain about 1 inch in penis length. Pelvic floor exercises, also called Kegels, strengthen the muscles that support erections. To do these exercises, tighten the muscles you would use to stop urination midstream. Hold for 5 seconds, then release. Repeat 10 to 20 times, several times daily. Stronger pelvic floor muscles help push more blood into the penis during arousal, potentially improving firmness and size. Stress affects sexual function in several ways, including reducing testosterone and tightening blood vessels. Have you noticed how stress or anxiety can make your penis shrink temporarily? Finding healthy ways to manage stress through activities like walking, meditation, or hobbies helps maintain better sexual function and hormone balance. Many myths exist about penis size after 55 that need clearing up. One common myth is that penis size naturally shrinks significantly with age. While some changes do occur, dramatic shrinkage isn't normal. What happens instead is that erections might not be as full or last as long without proper health habits. The penis may appear smaller due to blood flow issues or weight gain, but the actual tissue doesn't typically shrink much. Another widespread myth is that pills, creams, or supplements can cause major growth. The truth is that most products marketed for penis enlargement don't work, and some may even contain harmful ingredients. If a product sounds too good to be true, it probably is. No pill can overcome the natural limits of tissue growth, especially after the body has finished developing in early adulthood. Some men believe that once erectile function declines, nothing can be done about it. This simply isn't true. Many causes of erectile problems can be improved or even reversed with lifestyle changes or medical help. Even men in their 70s and 80s can experience improvements in function with the right approach to health. There's also a myth that penis size matters more than anything else for sexual satisfaction. Research consistently shows that technique, emotional connection, and communication matter far more to partners than size alone. Learning to be a better, more attentive partner often leads to greater satisfaction than focusing solely on physical dimensions. Some men worry that masturbation causes the penis to shrink over time. This isn't true. Normal, moderate masturbation doesn't damage the penis or reduce its size. In fact, regular sexual activity helps maintain tissue health through increased blood flow to the area. When it comes to penis health and size, certain situations call for caution. If you try stretching exercises or devices, start slowly and stop if you feel pain. Pushing too hard or too quickly can cause injury rather than improvement. Gentle, consistent approaches work better than aggressive ones. If you notice sudden changes in penis appearance or function, this might signal a health problem that needs medical attention. Issues like diabetes, high blood pressure, or heart disease often show warning signs in sexual function before causing other obvious symptoms. Do you know that erectile problems sometimes serve as early warning signs for heart disease? Medications can sometimes affect penis function or size perception. If you start a new medication and notice changes, tell your doctor. Sometimes adjusting dosage or switching to an alternative medicine can help. Never stop taking prescribed medications without medical guidance, even if they affect sexual function. Dehydration and alcohol consumption can temporarily reduce penis size by affecting blood flow. Staying well hydrated and limiting alcohol can help maintain optimal function. While an occasional drink is fine for most men, regular heavy drinking can damage the nerve tissue and blood vessels needed for proper erectile function. Taking a whole-body approach to penis health typically brings the best results. This means working on several aspects of health at once, rather than focusing on just one technique or product. The same habits that protect heart health also support penis function. Regular exercise, healthy eating, not smoking, limiting alcohol, and managing stress. For men with existing health conditions like diabetes or high blood pressure, getting these under good control often improves sexual function as well. Following treatment plans and taking medications as prescribed helps maintain the blood vessel and nerve health needed for proper erectile function. Better controlled health conditions often lead to better sexual health too. Setting realistic expectations helps avoid disappointment. While dramatic growth isn't possible, many men can achieve noticeable improvements in firmness, responsiveness, and overall function. Some men even report that while physical changes might be modest, their satisfaction improves significantly as they gain better control over their erections and learn to work with their bodies more effectively. Finding the right medical help makes a big difference when needed. Look for a doctor who specializes in men's health issues and feels comfortable discussing sexual concerns. Many men avoid these conversations out of embarrassment, but doctors who work in this field have heard it all before and can offer solutions without judgment. Remember that penis health is just one part of overall sexual satisfaction. Learning better communication with partners, trying different approaches to intimacy, and focusing on mutual pleasure often leads to more satisfying experiences regardless of size concerns. Many couples find that as they age, they discover new ways to connect that bring even greater satisfaction than in their younger years. Starting with small, consistent changes tends to work better than trying to overhaul everything at once. Adding a daily walk, drinking more water, eating more vegetables, or practicing relaxation techniques are simple first steps anyone can take. These small changes add up over time and often make it easier to tackle bigger health improvements later. Finally, patience matters when working on sexual health. The blood vessels and tissues involved need time to respond to improved habits. Some men notice changes within weeks, while for others it may take months of consistent effort. The body has amazing capacity to heal and improve when given what it needs, but healing happens on its own timeline, not according to your wishes. Trusting the process and staying consistent with healthy habits gives the best chance for lasting improvements in both sexual function and overall well-being as you continue to age. Now, if this video helped you understand your health better, subscribe now for more insights every day. Thank you for watching.